We're making space for you ladies here on the Dare to Ask podcast. Welcome to episode 2, season 3. You're the expert on you.
Be curious about what gets in your way and then problem solve how to tackle those.
I'm Corey Jensen, your host for this Dare to Ask podcast. I'm a mom to a big family and have delivered 5 babies. And like many women, I try to stay informed about my wellness as well as the health of my kids. We've created a space to have open conversation about what's going on with a woman's body without feeling intimidated in a clinical setting. A place to talk like girlfriends do. A space that dares to ask.
We're here to make a connection, be authentic, and really get to know your provider. Yes, know the person behind the stethoscope. Dare to Ask will be where you hear the questions that we are all curious to know, but just need a space to do it. You've landed on the Dare to Ask podcast, show hosted by Corey Jensen and sponsored by Essentia Health.
It's less about just checking in and making sure someone's okay, and more about making sure they feel valued and cared for and that they're worth effort.
Not just buzzwords on episode 2 here, but mental health is really one of the biggest topics of concern in our country today. It doesn't seem like that is going to change. We're scratching the surface on the importance of mental health in our country, but we look to make things tangible, going deeper, parents and how to listen to their kids when they want help, as well as the shift that happens from childhood to teenager, how that affects their mental load. Dr. Ellison also helps navigate those emotions and gives us tools to best help our kids too, covering how it's rarely about one factor. Jo keeps repeating the goal for yourself when it comes to therapy and your mental health. And we'll also find out what she calls a one-sided relationship that's all about you, and it's totally magical. Let's get to it. Let's chit-chat like girls. What is it that you like to do for fun?
Crafting projects, so I love all sorts of different things and have collected all sorts of supplies to do lots of different crafts, and then I don't always.
Right.
Yeah.
You and I are very similar in this. I'm convinced part of my crafting is the purchasing and researching things for the craft stuff. Mm-hmm. And it might not even come to fruition. Yes. But boy, do I have a dream board.
Yeah.
What was the last thing you made?
I like paper quilling.
My kids have got a kit for Christmas, I think, last year. And it was far more advanced than they thought it was going to be.
Yes.
So that was put back on the shelf of maybe in a couple of years. You guys will be ready for that.
Right. It's relaxing and creative, but it also, like, you're limited. I like the idea of painting, but there's so much that you have to create out of nothing. I like a little bit more structure.
The skill that it takes a painter to see the end result and then begin. My oldest is, and she has that ability to just see and do. And you amaze me. I'm in awe. What about family?
Married. We've been married 6 years. Yep. Together 10. And we have a little guy who just turned 4.
Oh, nice.
And my husband has a kiddo who is 14. So I've been a stepmom for quite a while now.
Yeah. With your kids, do you craft with them as well?
Sometimes, but it's usually more of my activity.
Right.
For me.
This is my me time. Please don't play with that.
Yeah. Yes.
Tell me about your upbringing.
I'm from Minneapolis originally, or St. Louis Park, a suburb of Minneapolis. I'm an only kiddo. My parents worked for nonprofits and worked hard, and it was a good childhood. I have a lot of family around in the Minneapolis area too, and we're all pretty close, and it's fun to hang out together. So
when you get together for a holiday and your family, your extended Minnesota family, are you out snowmobiling or sledding, or is it card games and board games?
It's really just talking. It's just hanging out and chatting and laughing.
We're just visiting.
Yes, a lot of visiting.
A lot of visiting. Grown up in the Minneapolis area, how did little Jo decide to get into medicine?
I know from an early age I wanted to be a psychologist. I feel like maybe around early high school, because even before I took my first psychology class in high school, I knew that. Yeah. And that sort of confirmed it for me. But I don't really know how I became even aware of that as an option. Right. But I guess like in seventh grade, I won the most likely to wear a lab coat in a future profession award. So someone must have seen it somewhere.
Yeah, what a great foreshadow, right?
Yeah, right. Psychology just always came super easy. I remember in my AP psych class in high school, I was a nerd, and some of the cooler kids in the class, we'd get our tests back, and then one kid would like lean back in his chair and be like, "What'd you get, Joe?" It just always came super easy.
Yeah,
and
clicked.
That's how I kept going with it in school as well, as it was just never hard to keep learning about it because I just loved all of the information I could eat up about it.
Where did you go to college, and what was that next level to pursue?
So I went to Gustavus Adolphus College in St. Peter, Minnesota, like a step away from home, but not too far, and pursued psychology there. My other major was Spanish. That was really hard. It was a lot of hard work compared to psychology. It was just so easy to learn all of that new information. And then if you want to do something with psych, you pretty much have to go to grad school. So then kind of quickly figuring out what that next step would be. I went up to UND in Grand Forks. Again, I wanted to be kind of close-ish to home, not too far. I was lucky enough to get into that program there, the PhD program at UND for clinical psychology.
Okay. And directly after you graduated?
Yeah, I did not stop.
Yep. So it was just full steam ahead. Let's keep this train going. Where along the journey, if I'm putting some years together here, did you meet your now husband?
As part of our training process, you do 4 years up in your program and then a year of internship, which is a national match process, much like other medical specialties. And so then I matched in Fargo, and it was the first year that Southeast Human Service Center offered APA-approved internship, and I matched there. And so I didn't go too far. And I met my husband now for the last couple weeks of my internship. And I was already kind of scheduled to go back up to Grand Forks to work at a private practice there to get the hours I needed for licensure. So then we did a year kind of back and forth long distance and then back to Fargo.
Did you already have a job secured, or were you hoping I'll get a job, but kind of going to see where this relationship takes me?
Yeah, I had already had the job sort of secured back up in Grand Forks. And then I had another potential job here in Fargo. So I, over that year, just sort of transitioned back. And yeah, I wanted to see how it went, but it was obviously it worked out.
Spoiler alert, it worked out. Let's talk about that practice and what got you to Essentia today.
Yeah, in my graduate school and then right after I got licensed, I was focusing more on eating disorders and research specifically. But I really ended up missing the clinical work and working with people. And so I ended up going back into practice with people and made my way over to Essentia and then having that outpatient practice there, seeing patients in the clinic for therapy or for psychological testing. It's a nice variety. So psychologists can do psychological testing, so that adds sort of an added kind of variation to practice. So I can really try and solve a problem or sort of like try and figure out what's happening and use tests and data and figure it out and come up with a plan, and I like that a lot.
It feels like all sides of your brain then are being used.
Absolutely, yes. And therapy is very rewarding too. I don't want to make it sound like it isn't. It's just like a different set of skills, so I like to be able to use different skills every day.
Yeah. You know, you went from that place of not working with people as one-on-one and going, I missed that. So now to be able to have basically the best of both worlds.
Exactly. No, I think it's a really useful thing to be able to, on a regular basis, use different parts of your brain.
Right now, what are you passionate about? What are you excited about? What gets you going?
I think there are some really high level issues. So also at Essentia, I have an administrative role. And so I think that's allowed me to take this kind of bigger step back and look at the whole process of mental health and how people access it and types of providers that we should have available and how many. And I think there's some really big questions about mental health because the stigma is starting to go away. I think we're really talking about it, ways to go for sure, but we're talking about it more. So more people are seeking care, which is great. But we don't have enough people providing that care, especially in North Dakota, especially where we don't have as many professionals. I think the things I get pretty heated up, how do we make a case so that we can get the professionals we need here and get the reimbursement from insurance companies and some of these bigger pieces that really keep us from providing everyone who wants it with care.
Right. We're really in an interesting time right now. I think you've nailed a few things that I have on the agenda to talk to you about about today, and that is, where we are as a culture finally at this place where it's so much more acceptable to just simply even talk about one's mental health. Probably the greatest category of taboo for so many decades. And now we can talk about it. But we have this huge deficit in having the resources available. So people finally want it. Now we need the other people to be encouraged by this and get into this practice.
Yes. And we do have some good universities in town with good programs. So I think we're in this really interesting spot where we could be doing really well. Just need to keep thinking outside the box a little bit and pushing to get what we need.
Get people encouraged. So let's do that. Let's take that moment right now for somebody who is listening, and maybe it's them that have been kind of interested. Make a case for mental and behavioral health.
I think it is a very rewarding field to be able to see progress and see people improve, to learn about how the mind works and to provide therapies to people who need it. And again, to watch them succeed is wonderful. Your colleagues in the field are similarly motivated and usually kind of nerd out about the same things you want to nerd out about. And that's really, it's a wonderful place to work. I mean, obviously there are stressors. There are things, it's a stressful field in many ways too. But the only way to keep moving forward is to help people learn more about themselves and how to help themselves too.
Yeah. You're having the hard conversations on a daily basis, researching the hard stuff. And then you're obviously in clinic or you're talking in therapy with your patients about the hard stuff, where we're at as a country with suicide, celebrity suicide. When that sort of thing happens, it feels like social media kind of blows up with people talking about it and saying the phrases, it's the new thoughts and prayers. Check on your happy friends. But do people really know how to do that? We're saying these things. Do we know how to follow through? And I'm afraid as a general public, the answer is no. We say these things to make it seem like we want to learn more, but then how do we get to learn more? How do we actually be that supportive person for someone who's going through a troubling time?
Right. Those are really great questions and really big questions that don't have real concrete answers. But I think, what we do know about suicide and especially about the risk for suicide is there's a big social component. So feeling isolated, feeling uncared for, or like a burden, right? So both a lack of belonging and a sense of burdensomeness, those are huge risk factors.
Sure.
If we're looking to address those with people, it's less about just checking in and making sure someone's okay, and more about making sure they feel valued and cared for and that they're worth effort. I think we can do that in different ways. So I think if people feel awkward having a conversation about mental health, about suicidal ideation, and those are difficult conversations. Those are probably conversations can have obviously in the moment, but those are for professionals too. I don't expect everyone to know how to do a suicide assessment or to have to do those with their friends and family members, but to communicate the caring and the compassion is usually much more within people's wheelhouse anyway.
Making that effort. Showing up, holding space for the physical presence.
Right. And I think there's lots of ways to do that. There's sending notes, cards, text messages, letting people know how much you care about them and want to connect with them. And I think the idea of having that space to be there for people, another component of that is taking care of yourself. So you have a little bit of space for other people, because we all get really overwhelmed, and almost the idea of taking care of someone who's not feeling well feels overwhelming. So how do we balance our own stuff?
Onion of layers.
Right.
It just is.
Right.
Because we're always going to be complex people. We're humans. Part of my personal journey, having lost a baby, obvious reasons, deep grief and deep depression. And I will never forget having a friend say to me once, I know you're probably going to say no, but we'd like to invite you to this thing that we're going to do. I said to her, you're right. I'm absolutely not going to go and do that thing. But please don't stop the invites. And maybe it'll be a year before I'm ready. And that kind of ended up how it was. But she didn't stop inviting me to things. She didn't stop including me, even in that simplicity, even though I didn't go and I didn't do. But that helped me feel like I wasn't lost to my friends. I was still being thought of. That's one of the big things now to me that was so little at the time. And I'm sure that friend probably doesn't even remember it. But to me, it was a big deal. So I'm hoping that might be just what somebody needs to hear, whether they're going through the thing or they know someone who is and want to find out a way to be supportive.
Right. I think that idea of keeping that door open, that communication door open, because when we are feeling really depressed or down, if you've had an episode like that, you know how hard it is to take steps to undo that. It becomes so much harder. So the idea of, well, they'll just reach out if they need something.
Right.
That's not necessarily how people are feeling in those moments. It's sure texting you is a simple thing, but that's also, it feels really big. So checking on someone doesn't necessarily mean having to poke around and ask about symptoms or make sure they're okay, but more just saying, hey, we're thinking of going and doing something. Do you want to do something too? You might not say yes, but I want you to know you're totally invited to this, just like you're saying. Or I know we haven't talked in a while, but I'm here if you need anything, right? Those types of statements that are pretty easy. If you have the bandwidth to do that, it can make a big difference to someone who doesn't have the energy to take what seems like a colossal step and ask someone to do something.
It's natural that we're talking kind of in a peer group setting now for the parents out there, because it does feel like this very issue with our children, teenagers, and it feels younger and younger, whether it be bullying that they're dealing with or just some depression stuff, online cyber stuff. Our kids, they're going through so much. To be a teenager today.
Oh my gosh.
I know. I regularly, since I have teenagers, I say, I can't even imagine. However, I'm in it, so I'm imagining it and I'm seeing it. For the parent who was just told, I think I'm depressed, I'm thinking about harming myself. If that parent's like, I don't know what to do next. How can I be here for my child?
Right. Number one, I think validating is really important. I think parents, your knee-jerk reaction is to fix and to explain why it's not so bad. And, you're coming from the right spot there, you're trying, and that's great. But really what people need in those moments is that validation that I hear you and I'm sorry you're feeling that way, right? Let's figure out something we can do to address it. I have heard you, I see it, and now let's move forward and do something. Rather than, here's what I want to do, here's my plan for you, here's, but working with your teen on that or your kiddo on that. And that's where I think getting some professional help in there is really important. Yeah. I don't want to minimize any of that at all, but when you have someone who's very seasoned in doing these evaluations, you can really quickly then understand kind of what the real level of risk is. Is this something where we need to be hospitalized? Is this something where we just a more intensive outpatient program? Do we need outpatient therapy? What are the levels? Because it's easy to try and minimize or go full alarm bells depending on the situation. So getting someone who knows how to ask all of those detailed questions. I don't expect parents to be able to do a full assessment themselves. That's a lot.
Part of the parent handbook that we're all given. Right. It's just right in there. To a parent, of course, that's some of our worst nightmares is hearing those words I want to self-harm or suicide or I'm depressed, or you don't know exactly the extent of that. Okay, is this a tiny iceberg, or how big is the iceberg under what we're not seeing? Professional help. For sure.
And I think if you go back to that risk factor of feeling alone, feeling isolated, feeling burdensome. So we want these kiddos to feel that someone hears them, is there with them. There's no rejection. There's no isolation. There's no, obviously, again, when our plates are really full, when we're overwhelmed with everything, that can feel really overwhelming. But we got to have some space for them so they don't feel like it's a burden to share that or to have therapy appointments, even if we might be stressed.
Sure.
And that news might be stressful for us. That's not because it's a burden. It's thank you for sharing this. Now let's do something for you, because that's the most important thing is for you to get what you need.
And I'm hearing that in a way where the parent's already open to that. Now I'm going to flip the page. Now we've got parent who there is a huge obstruction. So let's say teen or child comes to parent and says, Mom and Dad, I think I'm going through some stuff. I'm having feelings, and I think I might need to see a therapist. And parent is like, no, you don't. Help. How can we navigate this?
some of the bigger questions then for parents who aren't interested in kind of mental health or mental health therapy, I would say typically there's some fear there potentially, or this idea that sort of by paying attention to it, we're amping it up, or that we're making it an okay thing to be, or those types of things. And I would say, I mean, there's just really no research that backs that up. If we're going to reduce symptoms, if we're going to improve functioning, we need to validate, understand, and treat. The goal is always to be done with therapy eventually. I do think there's definitely a place for long-term therapy, but I think for the vast majority of people, the goal is to give you the skills that you need so that you can basically be your own therapist. Yeah. We're not signing up for a lifetime of therapy. The idea is that we're going to get your kiddo some skills so that they can navigate this on their own and be a good member of society and manage this if it happens again next time.
Perplexing sometimes for some folks that are very accepting, and on the opposite end is it's not anything to be ashamed of. I think that there are some parents that are fearing like, well, then there goes I'm a great parent because my child needs help. And I thought I was the one who was going to help them. And they're saying they want outside help. So much can go back to like fear and shame of self.
100%.
And we have to just put that on a shelf. And even if it's just an inquiry session, find out a little bit more, because maybe there isn't going to be anything that's hugely intervening. But then if there is, we can go through it together.
Right. And I think with teenagers, and I think the pandemic gives people maybe an ability to take a step back as well. So this isn't just your parenting. This isn't a verdict on whether you were a good parent or not. It's the whole environment. It's the whole society. And for teenagers, it's always the shift from parents when you're a little kid. Yeah. Parents are your world. Parents are where you get your information from. They're who you have fun with. And then when you become a teenager, that starts to shift to your peer group. Yeah. And so you could be an amazing parent and you get, and I'm sure many parents see this in their children, you get a crummy peer group and all of a sudden everything shifts. This isn't necessarily, and therapists know that. So therapists are not sitting there thinking you're a terrible parent, right? We know that there's all of these things at play that you haven't been able to control and can't control for your kiddo, as well as basic biology components. And it's not all on the parents' shoulders. I think that's probably a holdover from our Freudian roots, maybe, that we're going to blame parents. And it's all about bad stuff that happened in your childhood. Bad stuff that happens in your childhood certainly has a major impact, but there's so much more to it than that. And especially the focus on what do we do now is so much more on the now than it is on the past.
Positive looks at parenting, teenagers, what we're going through, mental health, progress that we're making, even though sometimes progress can be very slow. Like you said, we're looking at trying to expand and get more resources available, especially in our region here. That is huge. Just the progress of 988, that now being a thing. We have a suicide hotline. Long time coming? Yes, but now it's here.
Right.
Peer that sees somebody going through an issue. There are some resources that we can be looking at. Could be a very dire situation. What else do we have available if it's not an in-person, right now I can see a doctor?
The focus of helping people feel secure and safe and cared about is probably the best way to go about doing these things, right? Is there really isn't necessarily something really magical about an ER or a hospital stay. Right. They definitely have their place, right? It's very important that if we have an absolute risk of something terrible happening, that we utilize our emergency services.
Yes.
Because that is what they're there for, to keep everybody safe. If we're in great emotional distress, depends on the situation. And that's where stabilizing the situation, making sure people are feeling physically safe so that if there's a relationship issue or something where they feel unsafe, that we're in a safe environment, maybe reducing stimuli so we're just not on our phones, we're present in the moment, we maybe have food in our systems, we're maybe trying to get some sleep, right?
There might be some basic needs simply not being met, and that could be a way of security.
Right. And trying to help make sure somebody's safe.
Yeah. Is there something that you find very important that needs to be discussed when it comes to mental health?
one of the biggest things that I would want people to know about mental health is that it's rarely one factor, right? So we've talked about this in different ways so far, but there's relationships, there's your brain chemistry, there's super stressful life events like finances and all sorts of different things that can impact how you're feeling. And a lot of those things grow slowly over time. So there isn't always a perfect time to intervene or to seek help, and there's usually lots of reasons not to. But really the goal is to set you up to do things for yourself, to learn more about yourself and to understand your tendencies, and both good and bad, and then hopefully build up those good ones and learn some new ones to augment, right? And to help improve your functioning. So I think it can feel scary to go into therapy or to seek treatment because it's, what is this going to be?
Sure.
But really, it's about you. You're the expert on you. And then your therapist is an expert on different types of coping skills and strategies to improve those areas that you're struggling with. And you work together.
You have someone in your toolbox, on your side, in your corner.
It's a magical relationship. I have a therapist. It's a magical relationship because you care about them as a person, but you don't have to talk about them and their life. And you don't have to like balance it out. Like,
Right.
I've talked about myself a lot so far. I should probably let this person talk about their stressors, right? You don't have to do that.
Right.
One-sided relationship,
Yeah.
all about you. Everyone could find a use
Right.
for that.
I've heard everybody should have a therapist. Let's talk mental health and preventative. How can I set myself up? You know, I'm looking ahead. Maybe someone who's listening right now doesn't feel like they need a therapist, but they want to be proactive.
Again, it's all about learning about yourself. So as long as you're willing and kind of open to looking at yourself and what you're doing. So I think even those little things that we might notice, like I'm really stressed out and then I tend to spend more money or something like that, right? Let's get curious about that. And when are you most likely to do that? And then kind of narrowed it down, and it tends to happen with these types of things. And this is the type of shopping I do when I'm stressed. Okay, then let's try and find some alternatives to that. That's the spirit of working on mental health. And so you can do that at any time you want, right?
Yeah.
You can just look for patterns in your life and work towards goals that you have and be curious about what gets in your way and then problem solve how to tackle those. A lot of therapeutic interventions and a lot of this sort of challenging yourself, the key to that is learning how to get through a little bit of discomfort, how to like push yourself past a little bit of discomfort. And that doesn't mean you have to be in pain. It doesn't mean you have to be like hating the experience, but we tend to just sort of avoid things that we think are not going to be fun. And we're really missing out on a lot of opportunities for growth and learning. You might learn that you don't like that. Easiest example is probably with our kids and trying food.
Yeah.
They don't want to try food because they're just sort of imagining how terrible it will be. And you're
Ew,
like,
that's dark and green. It's gotta be gross.
or like sweet potatoes or something. And you're like, it's the best option. It's delicious, right? But they're like, ew, no. And then because they just imagine that discomfort, but how bad is that really going to be? And the more you try stuff, it just expands your horizons, right? So with food, that's an easy kind of analogy to use. But hobbies with friends, if you challenge yourself a little to try something, it doesn't mean you have to sign up for that for forever. It just means I'm willing to put myself through something a little bit uncomfortable and see how I actually feel about it, rather than making all these assumptions.
We're in a curious space, I believe, right now, too, where we're saying things like we're building up our independence to say no to things and go, oh, that I'm identifying now that as a toxic relationship. And so I'm going to take myself out of that. And so now I have this ability to say no, and yes, that's great. But then what if it swings so far and now you have isolated yourself, you are no longer around like any groups of people, or got to find a little bit uncomfortable is okay, and you can still find your voice to say no when you need to say no.
The key there is probably communication. And I feel like that's also applies to so many things, right? You can identify something as toxic and get out. Have you communicated what's wrong first? There are always exceptions to the rules. So, I mean, abuse and things like that, right? But if you've identified a relationship that's really difficult and maybe not giving back to you in some way, have you tried to communicate that to the person about what you need, having an open conversation. And obviously, the other person is this whole wild card in that situation and whether they're willing to have those conversations. And then the idea is if you get your answer there that they're not willing to provide you with anything, that is super clear then. And there's less shame and guilt in getting away from those where you have clear information back. But then also we're not, like you're saying, kind of overdoing that pendulum swing where we're getting rid of anybody who doesn't immediately sense what our needs are, right? Which is more difficult because everyone else is going through their own stuff too. So it's important to draw boundaries. This is exactly what we're seeing, right? Is this pendulum towards being more aware of all of this. It's great, but we don't want it to overswing either and cause other problems for people. So everything in moderation, right? I mean, how many times do you hear that on this podcast? Probably a lot. I would say over communicate about everything. There's really no reason that you shouldn't be communicating. Yes.
It's true. Professionally and personally and your kids and your relatives. And there's always those events in life that aren't regular that we look forward to that we don't look forward to. The holidays come to mind. A dread can start building. You know, I didn't get along with Uncle Joe last year and he talked politics and I hated that and we have differing opinions and now I'm going to allow myself to be anxious about it for weeks. What kind of advice might you give somebody who has seasonal or situational anxiety or issues?
Like, let's think about what would a successful interaction look like, because I think people overestimate what that should look like, that everyone's going to be happy and laughing and enjoying everything.
Hallmark movie.
Right. But what is a realistic expectation for your family? Because some families are not super positive and bubbly. And so a really normal and positive interaction would just be everybody kind of quietly eating their food and talking about the weather and no one screaming. To try and manage that anxiety a little bit is just it doesn't have to be a Hallmark movie, right? I'm just going to get through it and I have these expectations. I know that almost regardless of what I say, Uncle Joe's going to get angry about something because he's just...
Get a rise out of me or something.
Typically, arguments or fighting it's a two-way street. If you're boring, someone else will get bored too, and they won't continue to poke. So that's a bully technique that's, it works generally is if you are pretty flat about something like, I don't like what you're saying about politics. Can we talk about something else? Oh, why? If they start puffing up and
you're a blah, blah, blah.
Right. And then if you just stick with it and say, that's nope, I'm not going to engage in that conversation. Let's talk about this. Try and move on. The more they amp up, the more that should be clear to everyone else who the problem is, as well as it shouldn't be rewarding for them. If you're not getting really tense and activated and upset, it should be kind of boring for that person and they'll probably stop.
My card up my sleeve at the end of that, no matter what, is I always have the choice to remove myself. So, if you're like, I can't change Uncle Joe, he's going to always be this way. But what I can do is get out of my seat and go to another room or go outside for a walk.
Go to the bathroom. No one's going to bug you in the bathroom. It's a super safe spot, usually at almost all kinds of gatherings in all locations. Just go to the bathroom for a while and take a break until you feel like you can go back.
Just a fast little tactic. That might get you through an event like a holiday. Or Joe, you have been such a treat. We could create an entire podcast and do one daily from now until the end of time and talk about mental health. We really could. So it's unfair to say that we can just put this into a nice little package here and cover all the bases. I always ask my guests, or at least I like to, about a health nugget that you do.
I would say I try and think about what I really need to balance out my day. So at the end of the day, is this a day where I need to exercise? Is this a day I need to reach out and talk to somebody? And then I'll often try and talk myself out of that. That's usually a very
human nature, right?
Common part of the process is no, I don't want to go get my shoes on and go do the thing. But that looks like a lot of work. But what will the rest of my night look like if I don't do that? So especially if I've had a rough day at work, I might just want to sit and scroll on my phone and not work out. But I think about what's my night going to be like if I don't work out? And then I'm going to be mad about that later. So nope, I really should. trying to look at what's the consequence of talking myself out of this thing that I need.
It sounds like you have identified, your own little things so that you're able to make it different every day, because it just might be that way.
Right. Yep. I'm a mental health professional, but I think that's the idea is like, you just have to learn about yourself. And I think really learning your own tricks and trying not to let you use your own tricks against you.
I like that. Oh my gosh, that I could print on a t-shirt. Thank you so much for joining me, and I hope to have you back.
Yes, thank you.
Dr. Jo Ellison, such a wealth of knowledge. Refreshing to talk about mental health so candidly and so real, which is what it's all about here. Real talk for women. And thank you for listening to another episode of the Dare to Ask podcast.
The information contained in this podcast is not intended to be a substitute for personalized professional medical advice, diagnosis, or treatment. The information is general in nature. If you have questions or concerns, please contact your provider.